Thank you so much for joining us today. The webinar, The Troubled Newborn Puppy. In this webinar, Revival's Director of Veterinary Services, Dr. Marty Greer, will be sharing her knowledge on newborn puppies and more specifically on how to help those struggling pups. We do want to give a quick disclaimer on this webinar. Some of the images shown during the presentation will be graphic, so just a heads up on that. Now, Dr. Greer has more than 40 years of experience in veterinary medicine with special interests in canine reproduction and pediatrics. She received her Doctor of Veterinary Medicine from Iowa State University in 1981, and she's served as Revival's Director of Veterinary Services since 2019. So thanks for joining us today, Dr. Greer.
How does that happen? How does that many years pass? So we're going to talk about the troubled newborn. And by that, I mean the neonate and the pediatric patient, because we're going to go into some detail on some things here that we haven't covered before. So for those of you who think you've seen all the webinars that I've done or been to all my presentations, this one has got material in it. It's not completely new, but there's material in here that has never been presented before. So hopefully, even those of you who are extremely experienced in raising dogs will leave here saying, oh, wow, I didn't know I could do that. So we're going to go through a lot of really great material. So question is, how do you fix this? This poor little Schipperke puppy with this very serious congestion, or this little guy with terrible diarrhea. So what can we do to help these little kids out? So this isn't quite the same as our first couple of webinars. The first one was on the very, very, very first hours of life. The second one was on placing puppies into their new homes. And then the third was going through some additional things like normal neonatal development and some other things. So we're going to go through material today that has never been presented before. So this is about the older puppy, the neonate, and the pediatric patient. Pediatric meaning somewhere between 6 and 12 weeks of age is when they're in that pediatric period. So we're going to talk about diagnostics that can be done on the puppy, the value of a postmortem exam and how to get those accomplished if you're struggling with that, how to shotgun treat the sick puppy, and then specific treatments for sick puppies. So we're going to go through some things that are really specific to each individual medical condition. So the typical sick puppy can only have a certain number of symptoms because there's only so many things that you can notice by taking a look at these guys. So are they small to begin with with a small birth weight? Are they gaining weight poorly? Are they failing to nurse? Are they crying too much or not enough? Because that extremely quiet puppy is as concerning as the puppy that's crying too much. We're going to talk about rejection by the dam. If puppies are running a fever, having vomiting or diarrhea, having dark urine color, having a distended abdomen, if they have any respiratory disease, coughing, sneezing, or nasal discharge. Littermate death, of course, is the ultimate terrible thing to have happen. And then can they have other symptoms? So we're going to talk about all these things. Neonatal success is really dependent on a lot of different things. And this is a diagram from NeoCare, the French veterinary school at Toulouse, France, and their studies that they've done on the neonates. And they have published 125 papers a year. They're very prolific in putting out materials on raising puppies. They've done some really great research. So our puppies are really dependent on the bitch's age and her vaccination status, her nutrition, how the pregnancy went, that's gestation, how the whelping went, that's parturition, what kind of colostrum she produced and whether they were able to ingest it, their nutrition after colostrum into milk, and the environment that these puppies are in. And although these arrows all point out, they really should be pointing in, but this is the diagram that NeoCare has. And so I'm going to give them complete credit for this because it's a great diagram of how things all interact, but I look at them as all kind of pointing the other direction. And then we have where along the way we have these problems. The total pre-weaning mortality is between 0 and 60 days is this whole time period that we're looking at today. So we can have stillborn puppies, puppies that are born deceased, and that can happen, of course, right at birth. We can talk about the total neonatal mortality between 0 and 21 days, the early neonatal and the late neonatal death, which is between 0 and 21 days, and then the pediatric death, which is somewhere between 21 and 60 days. So those are the ranges of time that we're talking about today. And these are really heartbreaking things to have happen. Although a stillborn puppy is devastating, I think it's even harder once you've started to become attached to those puppies and they have a little bit of a personality and you've really spent your time, your heart and soul are going into these puppies. So the transition from total dependence to total independence is really a huge one. We've talked about that before. I'm not going to cover all that again, but shouldn't all puppies be born alive? Why do we lose puppies? We're going to talk about that. What do we take for granted? Why isn't this easy? And it's just not. A lot of people think, oh, it's easy. You just put a male with a female dog, and then you have a litter of puppies, and then you sell them all, and then you go to the bank and you deposit the money. It doesn't really work quite that easily, because a lot of things can go wrong. And I'm going to talk to you today about what we can do to improve your outcomes. And we've talked about this before. So again, we're not going into a lot of detail, but I just want to review the 4 H's. So remember, hypoxia is a puppy that doesn't breathe and get enough oxygen at the beginning. Hypothermia are the puppies that are chilled. Dehydrated puppies and hypoglycemic puppies are the puppies that don't get enough to eat, so they're dehydrated and they're not getting enough glucose, enough nourishment. So those are the 4 H's. And as you can see, they're in a circle, because if one side starts to fail, they all fail. So it's very important that we're paying attention to all 4 of these. NeoCare had 3, I added a 4th one. So I think it's really important that we're keeping in mind the 4 H's. Reports of loss of puppies are somewhere between 20 and 40% from conception to the time that the puppies are old enough to wean and be sold. And that's a huge number. That's very devastating financially and emotionally if you lose any of these puppies. And we do have reports in the literature of between 6 and 18% of puppies, even at C-section, that are lost. So we want to do everything we can to support these puppies. It's really important, because I know how hard you work at selecting your breeding stock, raising them, timing your breeding, managing the pregnancy, and managing the whelping. I do this too. Remember, I'm a breeder too. So I get it. I understand this. I live the same life you do. I'm in the exam room several days a week. So I just want you to know that I totally get this. And there's a lot of things that we can do. So this isn't Marty Greer talking about things that are theoretical. This is Marty Greer in her own whelping box, Marty Greer in her own veterinary practice, and what we know from what we can do to improve things, because I learn things every day from my clients. So I want to share that with you. So diagnosing sick puppies, there's only a certain number of symptoms and signs that they can exhibit, because really, other than being weak and sick and dying, what else is there? So we're going to talk about those things. The first things that you need to manage are going to be the 3 important things that you can measure at home. And that's the puppy's weight at birth and their weight gain. They should gain 2 to 4 grams per day per kilogram of anticipated adult body weight. So if you have a dog that should be 66 pounds at the time that they're a mature dog, that's 30 kilograms. So you can multiply 30 times 2. So they should gain 60 to 120 grams a day. So you can do the math on this, regardless of the size of the dog, whether it's a Maltese or a Great Dane. You can do the math on this. This is what you should expect to see for weight gain, and they should double their weight, their birth weight, in the first 7 to 10 days. We used to say puppies could lose up to 10% of their body weight and not be concerned. But from NeoCare's information, we know that they shouldn't lose more than 4%, or they have a very high increased risk of death. Their body temperature should be over 96 degrees Fahrenheit. And their urine color should be pale yellow after the first time that they urinate, after they're born. It should be a pale yellow color. You don't want to pick up the betadine that you've got on the umbilical cord. You don't want to pick up the feces. That'll confuse your color. But urine color should be a pale yellow. That tells us that they're adequately hydrated and getting enough to eat. So what do we do if we have a sick puppy? Well, just like you do with your big dogs, if you have a sick dog and you go to your veterinary clinic, we can do blood work. And a lot of veterinarians are like, okay, it's a sick puppy. I don't know what to do. I'm done. I don't know what to tell you. I don't know what to do. And I want you to just keep in mind that puppies are just little dogs. They may not have the same resources. They don't have as much glycogen in their liver for resources. They don't have as much body fat. They chill easier. There's a lot of things that they're more fragile, but they're still just a dog. They're just a little one. So when you go to your vet clinic, you can ask for them to do some of the same diagnostics they do on big dogs. So we now have these itty bitty little tiny tubes that just take a couple of drops of blood to run veterinary lab equipment in our hospitals. So we can do a complete blood count, a CBC, checking their white blood cell count, red blood cell count, all those things. A normal puppy is always anemic because that's the way they are born, but they should have a normal white blood cell count. They should have a normal platelet count. So this isn't rocket science. It's the same parameters that you would look at in a big dog. The chemistry screen, again, you can run a chemistry on just a couple of drops of blood that goes into the green top tube. It doesn't take much blood, so you can get a lot of information on those puppies. We can do a bile acid test. That's a test on liver function. We can do a blood culture if we're looking for any evidence of an infection. And of course, we can do DNA tests, and that doesn't even have to be a blood sample. That can be a cheek swab. Now, DNA tests take a little bit longer to turn around and get results back on. The bile acid we can get the next day. The blood culture we can get in 2 or 3 days. The CBC chemistry, if your vet clinic has equipment that can run these tiny samples, they can have that information for you in 20 or 30 minutes. So we can very quickly start to get information about these puppies and knowing what we need to intervene with, because if we have that information, we have now a treatment plan as a veterinarian to say, this is what's wrong with the puppy. This is how we're going to support that puppy. And they get treated just like a big dog, except they're littler. So there's just some small changes. Liver function tests, most puppies have low liver enzymes because their liver isn't fully developed at this point for the first 4 weeks. So that's normal to see. And there's actually some dogs that they are now able to DNA test to tell us that they always have low liver enzymes. That's just normal for some dogs. Abnormal bile acids. A bile acid is a test that we check liver function with. And so we'll typically draw a blood sample, feed the puppy, and then 2 hours later, draw another blood sample. If the bile acid level is extremely high, we know that puppy may have a liver shunt. So again, that's really important information. And that's something that we see in very young puppies. A lot of people are aware of that condition. Those are puppies that typically don't gain weight well. They tend to be dull. Maybe they'll seize after they've had a meal. So that's a pretty common thing for veterinarians to know to look for. If you're selecting drugs for puppies because their liver function isn't fully mature when they're 4 weeks old or younger, then we need to adjust our drug doses. If it's a water-soluble drug, I'll typically increase the frequency, like amoxicillin, to 3 times a day. If it's a drug metabolized through the liver, then we may need to decrease that dose because their liver function is different than an adult dog, and they won't be able to metabolize the drug as quickly. So your vet can figure this out. They can look up the information on how drugs are metabolized and adjust doses accordingly. The alkaline phosphatase level is always high in a young puppy. It's sometimes considered to be a liver enzyme, but it's not a liver exclusive enzyme. It also will indicate bone growth. And of course, puppies, especially large breed puppies, have a lot of bone growth in their young days. So the alk phos level is always high in a neonate. The ALT should be normal. That's a different liver enzyme. Kidney function test, the BUN is always high for the first 7 days, and then it'll go to the normal level. Urine should be fairly dilute. And if they're checking specific gravity, instead of just looking at it on a cotton ball, it should be 1.006 to 1.017. That will help tell us about hydration. And the SDMA test, which is now a test that's on several of the blood panels that get sent out to the diagnostic labs like IDEXX and Antec, it is not a reliable test until the puppies are mature. So that may be 6 to 12 months of age. So if you see an elevated SDMA in a young dog, I don't get excited about that. Blood sugar, however, should be normal at 90 or slightly above. There's a test kit that you can purchase called PET test. And it's a very easy test to run. All you need to do is have this PET test and the little lancet that you stick the foot pad with and the test strip. It's a very simple test to run. And in fact, I've got a video here of one of my technicians running the sample on a puppy in our hospital. So this little kid came in, he was normal, but we just needed to do a blood sample to show the video. So I had a client that was very kind and let us do this. So you stick the foot pad, you put the test strip into the machine, you push the button to start the test. And in that exact amount of time, this is not time lapsed, this is the amount of time it takes to get the glucose level, this puppy is normal. Very easy test to run. If you have a glucometer at home because you have a diabetic family member, you can use that. If you don't, for $50, you can buy the SDMA or the blood glucose test, the PET test kit. Very simple to do. If you have a puppy with diarrhea, there's a couple of tests that should be run. An O&P or ova and parasites is the flotation test that can be done at your vet clinic or sent out to a diagnostic lab. The ELISA test is a really nice test. It checks now for up to 13 different antigens of parasites in the stool. There is a Giardia test that can be run in the vet clinic if you're waiting for results and you need them quickly. But if you send the test out for about the same price as the veterinarian can run the test for just Giardia in the hospital, you can run a whole panel of between 4 and 13 tests, depending on which diagnostic lab it's sent out to. And then, of course, we have the Parvo Snap test. If we have a suspect Parvo puppy, that result can be done in less than 30 minutes. Okay, so that's blood and feces. Now we're going to talk about urine. So a urine test, again, runs just in a few minutes at the veterinary clinic. We use a dipstick, which is just a little test strip that gets put into the urine. We can check specific gravity, which tells us how concentrated it is. If we suspect an infection, we can do a culture on the urine. And if we suspect an inborn error of metabolism, you of Penn at the veterinary school can run an organic acid test looking for some of those inborn errors of metabolism. If we need to take an x-ray of a puppy, again, it's really simple to do. This is an empty Mountain Dew bottle, as you can see. This has the ends cut off of it and the label removed. And the reason that we do this is so we can put a puppy into this little thing. We slit it down the middle so we can slip the puppy into it. And when our technicians are trying to take an x-ray of the puppy, instead of our fingers being in the x-ray beam, which is a big no-no, we can put the puppy in this little plastic tube, which everybody has one of these in their recycling bin or in their lunchbox. So you can do this very easily. Take an x-ray of the puppy and get the puppy nice and straight on the x-ray without having the technician's fingers in the way. Like I said, that's a big no-no. Now, this is one of my own personal puppies, and there's nothing wrong with him. He was just a very young puppy, and the day I was writing this, he happened to be laying around my whelping box, so I just took a clear plastic bottle, popped him in there, just to demonstrate how nice and straight these puppies are inside that tube. So it's a simple thing to do. Veterinarians can have PVC tubing. There's a lot of different ways you can do this, but it's a really handy way to take an x-ray of a puppy. This is a really nice example of an x-ray of a normal puppy and an abnormal puppy that are litter mates. So again, if you have a sick puppy and you take the puppy in, never just take the sick puppy with you, always take at least one normal puppy with you so that the veterinary clinic can see what normal looks like for that puppy, for that breed, for that age in the rest of the litter. And if they're unsure, for instance, like with this puppy, we can see that there's an abnormality, and I'll point it out in a second, but they can compare the normal puppy, which is on the left, to the abnormal puppy, which is on the right, and clearly see that there's a difference. So on this x-ray, the sternum, which is this piece of tissue right, or bony tissue right here underneath the heart, that runs along here, this is a normal sternum. And if you look at this puppy, you can see the sternum goes up. This is a puppy with a pectus excavatum or a swimmer puppy. So we can see the difference between the normal puppy and the abnormal puppy. So if your vet clinic says, well, I don't know if this is normal or not, you pop the normal puppy on the x-ray table, you take an x-ray, voila, you have an answer. Very simple to do. Things like barium swallows can be done on young puppies. So if we have a puppy that's regurgitating as they start solid foods and we want to know if they have a defect in their swallowing mechanism, we can give them a little barium. And this big white area that's right in the right-hand side, that's barium, and it came out of the esophagus normally. I don't have an abnormal puppy on this particular set of slides, but you would see a lot of this white barium inside the chest if the puppy had a megaesophagus instead of in the stomach. So again, a very simple test to do on a young puppy. If we have any suspicion that there's something going on in the abdomen, we can ultrasound the puppy very easily. Ultrasound lends itself very well to newborn puppies. You can check for a presence of a bladder or a ruptured bladder. You can look for free fluid in the abdomen. You could look at the size and shape of the kidneys and the liver. We've seen puppies with renal dysplasia you can pick up on ultrasound. We've seen puppies with gigantic livers that we can pick up on ultrasound. So it's a very simple, non-invasive, easy test to do. And it's very useful to diagnose puppies. If we have a puppy that we suspect might have hydrocephalus, like this little pug puppy, and it has an open soft spot on the middle of its top of its head, that little domed area has a soft spot where there's not complete bone, the ultrasound probe can be placed on that, and you can look inside the puppy's brain. This particular puppy has hydrocephalus. So these two large circles of black here are fluid inside this puppy's brain. This puppy has pretty severe hydrocephalus. So again, it's an easy test to do. It's something your vet, if they have an ultrasound machine, can do very quickly for you and give you an answer on whether this puppy is a normal puppy and should be sold as a normal pet, or if it's a puppy that should have some additional interventions before you sell. Listening to the heart, again, is a really important test. Simple to do. All veterinarians can do this. All it takes is a stethoscope and a quiet room. There are two kinds of general categories of murmurs that we hear: the soft murmurs that are just a functional or innocent murmur, sometimes a physiologic murmur. Those are pretty common in young puppies. Typically, they'll go away by the time the puppy is 12 weeks old, and it tends to be a grade 1 or a grade 2, really hard to hear, but very soft murmur. And almost always those go away. If the puppy has a loud murmur, that's a puppy, again, that should see a cardiologist before you sell it as a normal puppy, because it may have a serious heart defect. We just had this happen at our practice a couple of weeks ago, where the puppy came in, had been seen by another veterinarian, somehow it got missed. And before we did an anesthetic procedure on the puppy, of course, she had a physical exam, and it turned out she was not a candidate for anesthesia that day. So why do puppies have innocent murmurs or these physiological murmurs? Well, because they're always anemic. That's absolutely normal. So their blood has more less viscosity. It's more watery. So as it goes to the heart, it can make more noise. So that's not uncommon. It may be that they have a fever. They may be stressed. You may have put your hand underneath the chest and reshape the chest, especially on kittens. And puppies can happen as well. So a murmur can sound like it's there, but if you reposition the stethoscope, it may not actually be there. But again, this is why a veterinarian should be looking at your puppies so that we know if they have a heart murmur before they're sold. Now, if the very worst thing happens, and it does sometimes, and you lose a puppy, please do not put the puppy in the freezer. Please do not take the puppy out and bury it. Please get an autopsy or a postmortem done on the puppy. There is no disease of fading puppy syndrome. That's just a garbage can category of we lost a puppy or puppies, and that doesn't tell us anything. There's always a reason the puppy dies. And if we lose a puppy, we need to learn what happened to that puppy so we can prevent the littermates or future puppies in your kennel from dying. So information about this is absolutely critical so that you can improve what you're doing. Now, these are where the graphic pictures come in. So if you're a little squeamish, please look away from the computer for a few slides. I'll tell you when to come back. Now, this is a puppy that was a walrus puppy or an anasarca puppy. It doesn't take a postmortem to tell what happened to this kid, but it's important to note in the record that this puppy, as a C-section puppy, was a walrus puppy. And although every now and then we can save them, this puppy was so severely affected that there was no way for this puppy to breathe or to get a tube into the trachea to help it breathe until the fluid was cleared. This is a placental defect, not caused by a problem with the puppy itself, but the placental formation. This is mostly a problem in bulldogs, but we can see it in other breeds as well. Now, this is a puppy that had the trifecta of midline defects. She had a cleft palate, as you can see on the left-hand side. On the right-hand side, over her shoulders, you can see that red dot. That is a spina bifida lesion. And then on her left side, in the picture on the right, she has placenta, but between her back feet are her intestines. So this is a puppy that had 3 midline defects. Fortunately, instead of affecting 3 puppies in the litter, it only affected 1. Unfortunately, it did affect 1. But we don't need a postmortem to tell us what this puppy died from. But again, these are things you need to have in your veterinary record and in your personal medical records so that you know why you're having problems with puppies. If you're having repeated problems with midline defects, we need to look at the diet. Is there a vitamin A excess? Is there a folic acid deficiency? Do you have a genetic problem? So without this information, you're going to continue to breed puppies with problems. And if you do have this information, we can step up our game and reduce the risk of you having midline defects. Now, this is a perfect example of a single puppy that died in the litter. She came in because the owner was concerned that she was going to lose other puppies. She'd had herpes previously in a litter, so she was a little terrified that she might have herpes again. We opened up this puppy, found she did not have a large intestine. Her small intestine connected from her stomach to her rectum. So this is not contagious. This is not going to affect other puppies in her litter. She could go home, take a deep breath and say, okay, this is the only puppy I'm going to lose from this group. But otherwise, she would have gone home and stared at the ceiling every night, worrying in bed that she was going to lose another puppy. So this information is absolutely critical for you to have to move forward in your breeding program. This is a fluke. It's not going to happen again. Now, this is a corgi puppy that I lost. Important information. And this guy had an infected umbilical cord that caused him to have peritonitis and die. Now, we had, at that time, instead of dipping the cords in tincture of iodine, which is iodine and alcohol, and we do have a clean cut product in a little bottle for that, so you can dip cords. I, at the time, was dipping in chlorhexidine because that was the recommendation. And as you can see, it didn't prevent an infected umbilical cord. So I went back to tincture of iodine. But this kid was normal, at least I thought was normal at 2 o'clock in the morning when I checked on him. And at 4 o'clock in the morning when I checked on him, he was dead. So again, this postmortem, all those little white flecks on his intestine and the redness of his intestine tell us that he had peritonitis. This is the information I needed so that I didn't make this mistake again. I learned from this and I moved forward so that I changed what I did in my breeding program. So if you lose a puppy, you need to bag the puppy, refrigerate it. And I know it's kind of icky to put it in your fridge, or if you don't have a refrigerator, you can put an ice pack in a styrofoam box or a cooler and keep the puppy cool, but do not freeze the puppy, because if you freeze the puppy, they can't do postmortem tissues. If you have a puppy that you lose, contact your veterinarian to ask if they can do a postmortem, if they'll be willing to, or if they would prefer that you send the puppy to a diagnostic lab, because they can do PCRs and cultures and all kinds of tests at the diagnostic lab that your vet can't do. You can look at the tissues grossly at the vet clinic like this, but you can't get microscopic looks at the tissues because veterinarians aren't set up to do that in their hospitals. So this is a puppy that I would have sent to a diagnostic lab if I didn't know what happened. If you know what happened, then you can now specifically have a diagnosis for why I lost this puppy and move forward with an appropriate treatment. If your veterinary clinic cannot do a postmortem, will not do a postmortem, or does not have a good diagnostic lab to send to, I'm going to recommend that you send to the University of Wisconsin, the veterinary diagnostic lab there. This is their website. You don't have to live in Wisconsin to use their lab. You can go to the website, look up their requisition or their submission form. You do have to have a veterinarian's signature on it, but this lab probably does the best job of any lab that I've seen in the country in getting you an answer on infectious diseases within 48 hours. So within 48 hours of the time they receive a puppy, they have run PCRs on 12 different viral and bacterial diseases. So you can very quickly have an answer and very quickly adjust your treatment plan to specifically medicate your puppies that are left for a condition that they might have. So do not hesitate to send your puppies in. It costs less than $200. And compared to continuing to lose multiple puppies in a litter, it's really a lifesaver. Okay, so now we've got our diagnostics started. If we don't have an answer quite yet, because we're waiting for a postmortem, waiting for other test results to come back, what are the basic things that we can do to support our puppies? That's kind of the shotgun approach. We're going to just treat every puppy that's sick or might be coming sick with something until we can come up with a specific diagnosis and a specific treatment plan. So the basic things that we want to do are basic supportive care, fluids, plasma, glucose, electrolytes, antibiotics, and probiotics. So basic supportive care means keeping them warm, keeping them dry, providing oxygen, making sure they're fed, hydrated, and that they have normal stools. So keeping them warm can involve using the puppy warmer incubator. That's by Puppy Warmer. We sell those at Revival. That's Ken Sundin's company, where he makes these very, very, very good incubators, or using a whelping nest that has heat underneath it. So you can keep your puppies warm. You can keep them dry with towels. This is, again, the Puppy Warmer incubator, and we have a black mat in the bottom of that. It comes with that. And then we'll put a black towel in the bottom when the puppies first go in there and they're still wet from the C-section, and then pull that towel out because the heat of the top of the radiant heat heats that black mat and helps the puppies to dry and stay warm. If they may not be breathing as well as they should, or they're quiet, we'll provide oxygen with the Puppy Warmer oxygen concentrator run into the incubator. If they are not getting enough to eat, or they're dehydrated, or they're not getting adequate amount of food, so they're gaining weight, you can bottle feed or you can tube feed. And we've gone through this several times. It's in the Learning Center on the video. There's a link that Dustin's going to put in the chat for you on how to get to that Learning Center link. So this is a great opportunity, but I'm not going to go through tube feeding again because we've covered that plenty of times, and it's a great resource in the Learning Center for you. Hydration, we're going to do fluids. So you can give them under the skin, sub-Q. You can give them orally with a feeding tube or a bottle. So you can use electrolytes, you can use formula. If you're at the vet clinic and the puppy's large enough, they can put a catheter into a vein and give them intravenously. And the dose is going to be 1 cc per 30 grams or ounce of body weight, plus anything else that they've lost, or something like diarrhea. So if they've had 30 cc's of diarrhea and the puppy needs 30 cc's per gram of fluid, you just add that up to figure out how much they should get. If you're giving the fluids under the skin, you should be using normal saline in your very young puppies. They cannot metabolize lactate. And you don't want to give dextrose subcutaneously under the skin because of the risk of abscess formation. If you have a puppy, and I have seen some veterinarians recommend giving the fluids into the peritoneal cavity, IP. I don't recommend that. I think there's a significant risk to giving intraperitoneal fluids. So I give them under the skin, orally, or intravenously. If the stool character shows diarrhea, then we want to do our fecals. We want to talk about parvo. And there is a new treatment for parvo. We've mentioned this briefly. It's made by Elanco. I think the name at this point is called Kind 30, but it's still a conditional use product. It's a monoclonal A antibody. Here's the link to get to it. It's a monoclonal A antibody that specifically blocks the parvovirus. So this is not to replace vaccinations, but if you have a sick puppy or puppies that were exposed to parvo, this is given intravenously. At this point, you can only get it from a veterinarian because it has to be shipped on dry ice, kept in the freezer, in the deep freeze, and given intravenously. So only veterinarians have this product, but it is going to be a lifesaver. It significantly changes the length of time sick puppies have to be in the hospital if they have parvo. It will significantly change their outcomes. Of the 28 puppies in the study, all 28 survived. And I did some of the clinical trials at our practice. At the time, I had several litters of puppies. So I actually injected this into 30 of my own normal dogs as part of the safety study, and absolutely 100% safe. Amazing product. So I hope you never need this, but if you have parvo, this is totally a game changer on how we're going to manage these guys. All right, excessively quiet puppies are very concerning to me. They shouldn't be quiet. I can show a video of sick puppies to the poodle club, the women in the poodle club and men in the poodle club. And very quickly, I can have them tell me which puppy is sick and which puppy is healthy, just by the way they're moving around. So a very quiet puppy is concerning. Now, rejection by the dam, I think this is kind of interesting because I'm not convinced that most of the time, if we see a puppy off by itself, that it was pushed away by the dam. Every now and then we'll see a bitch do that. But many times I think that the sick puppy isn't with the rest of the group, not because it was pushed away, but because when puppies are moving around the whelping box, they're looking for temperature, they're looking for mom, they're just moving around. They tend to kind of swarm like bees. And if the puppy is sick, it's too quiet, it's too weak, it's too sick to keep up with the swarm. So I think those are the puppies we see off to the side. They get even more chilled. We need to get them warmed. We need to get them warm enough that we can feed them. They should be at least 96 degrees. Then we can start supplementing them with fluids, with food, and get them back to mom so that they can continue to thrive. The color of urine is a very important piece of information for us to have about the level of hydration of these puppies. If the urine color is a dark yellow on a white cotton ball or white tissue, white Kleenex, white paper towel, then I'm concerned about it. That tells us that the puppies are dehydrated. So monitoring urine color is very easy to do. Again, if we have fluid therapy that we need, this is the same dose that I gave you before. So if you want to grab a picture of that, that's great. So along with fluids, we need to talk about plasma. Plasma provides fluids, it provides clotting factors, it provides passive immunity from antibodies. So there's a lot of things that plasma does for us. We know puppies don't get much antibody through the placenta. Human babies get 90% of their antibodies through the placenta. Puppies only get 10%. The other 90% comes through the colostrum. And colostrum is only produced for the first 24 hours, and it can only be absorbed through the GI tract for the first 24 hours. After that, those big protein molecules called antibodies won't pass through the wall of the intestine. So we have to get colostrum into our puppies in the first 24 hours. Absolutely essential. If they aren't going to get that because mom is sick, because they didn't nurse, because too many puppies already ate all the colostrum before the last puppy came out, we need to give these guys some supplemental antibodies. And that can be done through plasma, which is the liquid part of dog blood. So you can see from this graph that puppies that ingest larger amounts of colostrum also gain weight more effectively. Again, NeoCare produced this information. Now, we do have a product called NurtureMate at Revival, and it does have colostrum, but it's bovine colostrum, which is still helpful, but it doesn't give us the basic antibodies that we need for canine diseases. So it's a useful product, but it's not going to replace dog colostrum or dog plasma. So how do we give plasma? Plasma can be given by a sub-Q injection at any age. It can be given intraosseously, which is another way to inject, or it can be given orally in the first 12 to 24 hours after life, after birth. But after that, it's not going to be absorbed through the GI tract. We can proactively give this to a puppy that didn't get colostrum because mom was sick, because mom died, because she didn't have enough milk when she had her C-section, or we can wait until we have sick puppies and give it. I have a lot of clients in our practice that are so accustomed to their puppies going home after getting plasma injections from our staff from dog blood that they're just like, please give plasma to all my puppies. I don't want to wait until I have a sick puppy. Just give it here, because they go home with those puppies feeling so much better and so much stronger. Now, Hemapet, I believe, is no longer able to sell this kind of product. So you can take a look at Animal Blood Resources based out of Michigan as a source for plasma. So you don't have to get it yourself. So how do we give it? How much do we give? The dose is 16 cc's per puppy, regardless of the size of the puppy. Whether it's a 2-ounce puppy or a 2-pound puppy, it still gets 16 cc's. But the smaller the puppy, the smaller the doses that you have to give, because their stomach capacity and their sub-Q capacity is not enough to allow for 16 cc's to be given in one dose. If you have a 1-pound Labrador puppy, you can probably give all 16 cc's at one time. If you have a 2-ounce Maltese puppy, you're going to need to split the doses up into smaller quantities. Again, you can give it in the first 12 hours orally by feeding tube. I don't think they'll take it in a bottle. I've never tried, but I always give it with the feeding tube. But you can give it subcutaneously or intravenously at any age. And I have a lot of people that are like, well, my vet's never heard of that. This must be new. But here's the original article that was published on this. It was published in February of 1992. That was like 30 years ago, folks. This is not new. So it comes frozen in bags from the blood banks. It's good for 5 years in your freezer. When you thaw it, you need thaw it at a thermometer temperature. So it need not be above 99 degrees or you will heat it up too much and damage the proteins. Don't microwave it. Put it in a bowl of warm water with a thermometer in it, thaw it out, and then you can give it as an injection or as through a feeding tube. Now, if we have a puppy that's not getting enough to eat and it's weak, we may need to give some glucose. This may happen in our toy breed puppies as they're weaning. This may happen in younger puppies before they're weaning if they're not getting enough to nurse. So you can give glucose. It comes as an injectable 5 to 10% product. You can give it orally. You can give Karo syrup. Or I really like this Eagle brand sweetened condensed milk. If you buy it at the regular store, it comes in a can with that lid that peels off and it's sticky and messy and it's hard to put in your refrigerator because it just goos on everything. But Walmart carries it in either a bag or a bottle. So I believe Walmart's the only company that has it in a form that's not in a can. But it's a really handy thing to have sitting around your house. I have several bags of this. We use it when we take dew claws and do tail docs on our puppies because that glucose helps reduce their stress levels. And it can also be used in constipated puppies. So if you have a puppy with constipation, glucose will help loosen up their stool so that they're not so constipated without giving an enema. If your puppy's dehydrated, you can use the puppy light. If they're old enough to drink out of a bowl, this is chicken soup based, so it tastes good. It's good for the dams. If they're not drinking enough to lactate, it's good for the babies if they're a little dehydrated, but it can be used as a feeding tube product as well if you have puppies that are just a little dehydrated and need some help. Antibiotics. Now, antibiotics I use routinely in very limited cases. I use them routinely if I have a puppy that was born with meconium in their fetal membranes. Meconium is the first fetal stool. So if they were born vaginally or by C-section, and this is a puppy with meconium on it, you can see that brownish, yellowish stuff over the shoulder. This is a puppy that had meconium in the membranes. I will send those puppies home on Clavamox or Naxel. Clavamox I use very frequently. And again, because it's a water-soluble antibiotic, I give it 3 times a day instead of twice a day, which is what the label says. So this is the dose I use for Clavamox. And then you can also use Naxel. This is an injectable cephalosporin antibiotic that is a large animal product, but your veterinarian may be able to get this for you and dispense it if they feel that it's justified. And the advantage of the injectable is that we don't have to worry about them having a GI upset from having antibiotics given orally. When do I give it? If I see meconium. If I see any signs of illness or sepsis in a puppy's, if the puppy's crying uncontrollably, I worry that it's septic. If the puppy has a blue belly, a distended blue belly, it may already be too late. This puppy may already be so septic that an antibiotic doesn't turn it around because it takes 24 hours for antibiotics to work. And we usually give injections to dogs intramuscularly if we want the drug to be well absorbed. But in newborn puppies, we know that it actually gets absorbed better from the sub-Q injection than from an IM injection because their muscles are so little and there's so little blood flow to them that they actually absorb drugs better subcutaneously. So again, another picture. This is the same puppy on the right, but this is a bulldog puppy that should be white, but it's yellow because of the meconium at the C-section. This puppy's placenta is still attached to the uterus. So this is a brand new puppy. This shows meconium. Is it okay to give other antibiotics? Well, that depends. You want to speak to your veterinarian about it. Albon does a great job with a lot of bacterial diseases and coccidia. I use a lot of amoxicillin and azithromycin if I have puppies that may be sick with respiratory. I use clindamycin if I have bone infections or I suspect that I might have neosporum. You want to avoid the Baytril, enrofloxacin, ciprofloxacin category of drugs for puppies that are weight bearing, so over 3 to 4 weeks old, large breed puppies. This can cause permanent damage to their cartilage. So bulldogs, large breed dogs, Labradors, Goldens, those things, you don't want to give Baytril and rofloxacin or Cipro when they are at a weight bearing age when they're young, because of the risk of damage to their cartilage, unless your other option is that the puppy's going to die. Usually there's other antibiotic choices, so I avoid that. You want to avoid metronidazole until they're at least 6 weeks old, because it will cross into the brain and cause some neurologic disease. Spectinomycin sometimes can be purchased over the counter, and it does do a decent job managing dogs with diarrhea. So that's an antibiotic you can get without a prescription, but almost every other antibiotic that we have on the market has gone away. It needs to come through your veterinarian. So have a great relationship with your veterinarian so that they can help you. All right. So if we have a puppy on antibiotics, or if we have a puppy with diarrhea, we want to reach for a probiotic. Nurture Flora is one of our new products at Revival. It is designed for newborn puppies and kittens. It's in a really thick paste that's sort of a molasses base. You can put a little dab on the roof of their mouth, and it does a great job of getting the right bacteria into their GI tract. Specific treatments. We're going to rattle through these pretty quickly. So grab your camera, grab your notebook, because we're going to go. So what are the specific things we can do to treat dogs with bleeding, respiratory disease, pain, skin problems, all that? So for bleeding, and sometimes this is spontaneous, I've had puppies just come in bleeding from their oral cavity, from some other part of their body, or maybe after a tail duck and dew claw removal. Puppies are born premature, so they don't have as much vitamin K in their liver as they should. So some of these guys will bleed. The dose for that is going to be an injection of vitamin K. It's a prescription product. You need to talk to your vet about it, but it will control bleeding in a lot of these guys. And also plasma will help with clotting factors. So if you have a problem with puppies bleeding, get vitamin K injections. If you have a puppy with respiratory disease, which would be coughing, sneezing, or nasal congestion, you can use a nebulizer. Puppy Warmer makes a beautiful nebulizer. It's not expensive. It's under $100. You can add an antibiotic like lincomycin to the nebulizer, and you can mist the puppies. So this is a little Skipper Key puppy that had some pretty serious nasal congestion. Both of the dogs in the litter did. So what can you do for that? We can nebulize with an antibiotic. We can use Mucinex. That's what got just guafenicin. You don't want a product that has other things in it. So just the straight guafenicin can be used. You can use little noses or little remedies. This is a saline nose drop for children. So again, you can use this. It's very safe for puppies as well. Now, the Skipper Key puppy I showed you 2 slides ago, this is he and his brother after we finally got through with a lot of patience, a lot of work, a lot of oxygen, and a lot of nebulizing. But you can see that they've grown up to be beautiful puppies. So this little guy is a sleeping puppy. Does he look like he's breathing normally? He's twitching, which he should be, and he's doing all the normal little nursing things he should be, but he's propped up on this pillow because he has pectus excavatum and had a very severe problem with respiratory disease. He's the puppy that I showed you earlier in that x-ray with the caved in sternum. So this is not a normal puppy. This puppy needs extra help. A crying puppy. Oftentimes, a crying puppy should be considered hungry until proven otherwise. So warm it, feed it, and then assess if it's got something else wrong with it. If they are screaming and you just can't do anything else with them, I use butorphanol injections. This is a controlled substance, again, a prescription product that can only be prescribed by your veterinarian. But if you've taken their temperature, warmed them up, fed them, hydrated them, you've got them on all the things that you should, and the puppy's still just crying inconsolably, and the bitch is distressed and you're distressed, butorphanol can get you through that. There are very few other things we can use that will safely sedate the puppy. If we have a painful puppy, we can use gabapentin, but we need to figure out why they're crying. Was there trauma? What else happened? We cannot use Metacam. We cannot use carprofen or Rimadyl when these puppies are really young. Their livers and kidneys can't handle it. We need to avoid those, avoid aspirin, Tylenol, ibuprofen, and naproxen, but we can give gabapentin if we need to, and it does come in a liquid form. Again, prescription product. Now, if we have a puppy that's either vomiting or regurgitating or has diarrhea, constipation, some other GI upset, we're going to go through that. And like we said, the GI tract is sterile at birth. Rapidly, bacteria move into there from the bitch's environment. But if we get a probiotic into them, like Nurture Flora, with the correct bacteria, we can get our puppies off to a good start. Meconium is the stool passed in the first 48 hours. A normal fetal stool or postpartum stool should be yellow, pasty, and kind of a tan and seedy looking. but not usually diarrhea. And by weaning, the stools should be formed. Regurgitation versus vomiting is kind of a challenge. Very few young puppies vomit. If they do, you can use itty bitty tiny little dose of metoclopramide, the same thing we give to bitches to help bring in their milk. If a bitch isn't feeling well or the puppy's a little bit older, famotidine can do a good job with GI upset. Now, regurgitation is different than vomiting. Vomiting is the retching thing that happens before fluid comes up out of the oral cavity. Regurgitation, they don't retch, this fluid just bloop, pops out. We can have a number of different reasons that this happens. It's usually a swallowing defect. We can see persistent right aortic arch, which is a defect of the heart, where the esophagus is constricted by the blood vessels. So those puppies will regurgitate as soon as you put them on a solid food. We can see megaesophagus, which is similar to persistent right aortic arch. These are diagnosed with barium swallows to see if the puppy is normal. So these both usually show up at weaning as soon as you start solid food, so 3 to 5 weeks of age. If you have a puppy with this, you need to get some x-rays, but you can put the puppy in a Bailey's chair until you can get a diagnosis. You can find these diagrams online for how to put the puppy in there. And basically, it's a chair that holds the puppy upright so that they can swallow food more effectively. Diarrhea is very common. At some point, the bitch will have diarrhea, the puppy will have diarrhea, you might stress out. So we need to know if our puppies have diarrhea, how we need to address that. So puppies cannot urinate or defecate independently until they're 18 to 21 days old in most cases. Overfeeding puppies will see a yellow or green watery stool. If we see a foamy bright yellow stool, that would be reason to be concerned about canine herpes. If we see a blood tinge stool, it could be coccidia, it could be sepsis. So again, you want to do your fecal testing at the vet clinic with an ELISA test and a flotation. If we see diarrhea, we want to use kaolin and pectin, not the human stuff. Human kaolin and pectin is no longer kaolin and pectin. It is now the same thing as Pepto-Bismol, which metabolizes as an aspirin. So please make sure you're getting the veterinary version, which is kaolin and pectin. Imodium, I have a lot of trouble with that. I see a lot of dogs that get it and it's safe, but I see about half the dogs that receive it for diarrhea then end up vomiting, so I avoid it. Never use Pepto-Bismol. Metamucil will help if the stools are soft. It'll help add form to the stool. Of course, a lot of people use pumpkin. That's great too. And then probiotics. If you have a constipated puppy, you can do enemas. So this is a little puppy that's constipated. So instead of using the feeding tube on the feeding tube end of the puppy, we're doing the feeding tube on the other end of the puppy. Once you've used the feeding tube rectally, don't use it again to feed. Get a new tube. So we're just putting a soap suds enema into this puppy. And again, this is a little graphic, but you can see as we pull that out that there's a lot of fecal material on there that's helping this little kid to pass stool. And remember that Karo syrup or Eagle brand sweetened condensed milk can help with constipation as well. If we see a pot-bellied puppy, it may be parasites. It may be that the puppy is septic or may have really bad diarrhea or just a lot of gas. So you want to get some diagnostics done on this puppy. If the puppy's just uncomfortable and gassy, simethicone is a great product. You can buy this over the counter. They make this for babies. Walmart has a version. This is a different version. This is the brand name. So it's a great product to have in your kit at home. Parasites can be lots and lots of different things. I am not going to go through the whole parasite process again because we have a 2-hour presentation on that. But do remember that putting the bitches on fenbendazole will prevent roundworm and hookworm infestation. Again, this is information published in the 1980s. Rectal temperature, very important that you're taking temperatures on puppies to make sure that they're neither too hot nor too cold. It's easy to take a rectal temperature. These digital thermometers work very quickly. Puppy should be over 99 degrees once they're more than a week old. If they're over 101 degrees, they may be overheated or they may have a fever. So you want to take the temperature on multiple puppies in the box. If they're all hot, it's probably a problem with the environment. You have them too warm. If you have one puppy that's hot, you probably have a puppy with a fever. There are many causes for it. It can be an infection like viral or bacterial. It can be inflammation. It can just be environmental. So sort out what's going on causing that. So the eyelids must be open by 10 to 14 days of age. If they stay closed longer, the puppy may have an infection behind the eyelids, and that can cause permanent damage. I've got a couple of dogs that have permanently had eye damage because clients didn't identify that they had a problem. Now, if you see swelling of the eyelids of even one puppy with one eyelid swollen, you need to get those eyes open immediately. This is a veterinary emergency. It's called neonatal ophthalmia. You can see the amount of pus draining out of this puppy's eyes as we open them. You can get the eyelids open at home if you put a warm compress on and get them open. If you need help, take them to a veterinarian. They need to be opened immediately. And they need to be put on both an oral antibiotic like Clavamox and a topical antibiotic and eye medication. Otherwise, we can have permanent damage to the eyes. The first 3 weeks after the eyes, or the first few days after the eyes open, their vision is a little bit poor because they have cloudy corneas, but eventually those clear and the puppies can then start to see normally. Now, puppy strangles is kind of an interesting disease. It starts off oftentimes as just some sores around the lips or the eyes or the ears. It also usually has enlarged lymph nodes in the neck. So these big lymph nodes, and the reason they call it strangles is because it looks like those lymph nodes are so big the puppy is strangling. This is a disease that we unfortunately see fairly often, mostly in golden retrievers and golden crosses in labs, but I've seen it in standard poodles. I've seen it in other breeds as well. And the veterinarian that identifies this must put the puppy both on an antibiotic and steroids, prednisone. It's a little scary to take a puppy that looks like this and put it on a steroid along with an antibiotic. My fingers on this puppy are around the lymph node. That's how big the lymph nodes are on this puppy. And you can see the lesions on her eyes. You can also see lesions on her muzzle. So you can see how broken out she is here on her eyelids and then around her lymph nodes. So this is a puppy with strangles. This does require both an antibiotic like Clavamox and a steroid. There's a lab puppy, usually starts in their lips and then moves back to the throat, the eyelids, and then the ears. But this needs to be identified and treated accordingly, or if we don't get these kids on steroids, they don't recover. And this can leave permanent scarring on the puppy. Skin lesions, we can see lots of things. We want to look for parasites like fleas and lice. We want to, again, we have a whole parasite program on that. If you do have a concern, you can bathe them in chlorconazole, which is an antibacterial and antifungal. You can use silver sulfadiazine, which is a combination of manuka honey and silver. Does a great job with skin lesions. If the puppy's itchy, you can use Benadryl. If you think it's ringworm, you can use Lotrimin. For ears, again, the ears should be open by 14 days of age, and you can either use the silver honey, Animax, or Tresiderm prescription items for ear infections. Puppy vaginitis, we frequently see this in the little females. It's really common to see that sticky little vaginal discharge. Do not use an antibiotic for that. Use baby wipes. Keep her clean. You can use these nursemaid wipes, keep her clean and get that cleared up, but she does not need to be on an antibiotic for that. Probiotics are also helpful. And then every now and then we'll see a puppy, especially bulldogs, but other breeds as well. This picture's a little blurry, but these are the rotated back feet. And this is very normal in some breeds of dogs. Do not euthanize these puppies. Let them grow up, do a little physical therapy. And typically by 3 or 4 days of age, the feet have rotated back into a normal position. So here's your drug list for the things you want to have from your veterinarian or to have your veterinarian prescribed for you if you go in. So again, this is information for your vet. These are things that you can pick up over the counter, Mucinex, Simethicone, all these things that you should have at home in your whelping kit. These are non-drug treatments again. Remember the heat, the oxygen, the bottle feeding, the tube feeding, and ivory soap for your enemas. So keep your babies warm, keep your babies safe. We do have these 2 books. We have your pandemic puppy for the newborn puppies before you place them in homes. I make all my people that buy a puppy from me read this. And then we have the canine reproduction and neonatology book. These are both available through Revival. And there's a lot of information. Chapter 8 is the pediatric topics. And so there's a lot of information in the book that's also given today.
Okay, so let's get a few questions. Okay, the first person asked, if you have babies that are nursing but not vigorously and you're supplementing with either bottle or tube feeding, suggestions about how to guess how much volume to supplement with when you don't really know how much mother's milk they've gotten. She says weighing isn't helping much.
Well, weighing before and after they nurse can be helpful. Checking the urine color is helpful. And if their urine color is still dark, they need more supplementation. And you're not going to suppress a puppy's interest in nursing. They're DNA programmed to suckle. So supplementing them will not reduce their need to or their interest in going over and nursing on mom.
Okay. Someone else asked, her vet is kind of refusing to give antibiotics to a struggling newborn pup. The vet says they're worried about side effects or antimicrobial resistance. She's feeling kind of helpless. Any advice for somebody if they find themselves in that situation?
And those are really important concerns. As veterinarians, we are educated regularly about not overusing antibiotics. So you need to develop a relationship with your vet that when you need an antibiotic, you can get it, but they should not be given willy-nilly routinely. So I agree with your veterinarian. You just have to figure out if you can set up some boundaries for when it's appropriate and when it's not appropriate. And so you have an understanding with them. Work closely with your local veterinarian, get a good relationship with them, take their staff pizza, not to bribe them, just to make them feel appreciated, and just keep working with them. They'll get to the point they trust you.
Okay. Do you ever recommend doing postmortems on stillborn puppies? Would it be useful in that situation?
It can, especially if you're looking for infectious diseases. Opening the puppy up at the vet clinic may not be very helpful, but submitting them to the diagnostic lab can pick up all kinds of infectious diseases: herpes, neosporum, toxo, lepto. There's a lot of things you can learn from that. So yes, if you're losing multiple puppies, I would have postmortems done.
Okay. Polly's wondering, at what age is ultrasound for atopic ureters done?
Ectopic ureters are usually not diagnosed on ultrasound. They're usually done by a contrast study and x-rays, like a CT or an x-ray. So typically that's going to be when they're probably 6 weeks and older, because you have to put in an IV catheter, put in a urinary catheter. It's a little tricky. So they need to be older.
Okay. Barbara's wondering, do you recommend giving folic acid supplements to breeding females prior to breeding, after breeding, anytime, when, and what type of supplements?
6 weeks before they're bred, all the way through the pregnancy. The dose, the only published dose we have is 5 milligrams per dog per day. And I did look the other day, and there's some supplements that have 1,330 micrograms. So it would be 4 of those a day. Now, if it's a large breed dog, I'd do 4. If it's a pug, I'd probably do 1 or 2. But you can buy folic acid. We carry some products at Revival that do have folic acid in them.
Okay. Somebody's wondering, what should be the room temperature of a whelping box area?
70 to 75 degrees. We don't want the room so hot you can't be in there and the bitch isn't comfortable, but the surface where the puppies are should start off at 90 to 95 degrees, dropping 5 degrees a week. Room temperature should be 70 to 75. You should not be cooking the room.
Okay. We'll do 2 more questions here. Tim is wondering, crackling in lungs, what is the treatment for that?
If it's very, very young puppy, I would suction the puppy with a Deely. If it's a little bit older, the puppy probably has pneumonia. So you probably need an x-ray and some antibiotics.
Okay. And Lori's wondering, can you plan ahead and bank your own dog's plasma?
You can. You need your veterinarian to help you with that. You can't be careless about how you spin down the serum or plasma and get rid of the red blood cells. You want to use a large male dog, not a female dog that's ever been bred. It needs to be a large enough dog to donate. So if you have a kennel of little dogs, you need a big dog. It needs to be at least 60 pounds to really get enough plasma. It takes 3 times the amount of blood it takes. So if you want 16 cc's of plasma, you need about 45 cc's of blood. You can very easily deplete a small breed dog. So you need large breed male dogs for that.
If you do have a question, call our Pet Care Pros or check out our Learning Center. A lot of these questions, a lot of resources are there in the Learning Center. The previous webinars that Dr. Greer has done on neonatal and newborn puppy care and just puppy care in general are all there in the Learning Center. And again, there's that phone number. Take a picture of that screen. So call our Pet Care Pros. I cannot emphasize enough how much information they have. And they work very closely with Dr. Greer. So thank you again so much for joining us today. I'm Shelley with the Revival Content Team. Thank you, Dr. Greer, and have a great rest of your day.
Hi, if you're watching on YouTube, consider subscribing to the Revival Animal Health YouTube channel. If you have a pet health question, call our Pet Care Pros at this number. And don't miss our other pet health videos.